Having to get an injection may be uncomfortable, but like your doctor says, a small shot won't kill you. This is true unless you live in South Asia, where we are facing one of the largest public health crises known to people, all caused by the stink of a needle. So what's going on? In the developing country, a public health crisis of HIV, hepatitis B, and hepatitis C are occurring through the use of needles in an unsafe method. This is known as unsafe injection practices. So, what are unsafe injection practices? In this video, we will focus 4 of them. They are reuse of needle and syringe, improper disposal, overuse of injection medication, and recapping of needle or syringe. So, first off, needle recapping is act of putting the cap that comes with needle back on the used needle by using 2 hands by healthcare worker. This means that approximately 385,000 needle stick injury occurs to healthcare workers in hospitals. Some healthcare workers also think that injection-based medication is always superior to oral medication. A misconception about effectiveness of injection medication leads to their overuse. The population need to be taught about the dangers of overuse of medication and to ask for oral medication whenever possible. Then we have the major issue of improper disposal of needles and syringe that contaminate waste site and allow scavenger to collect them and resell them. And finally, the most dangerous is the reuse of needle between patients. Many times the healthcare worker are these countries and their healthcare setting do not have a proper policy in order to deal with this needle stick injury, which causes hepatitis B, hepatitis C, and HIV disproportionately affecting nurses and other healthcare professionals. Worldwide, 1.5 million people die annually from hepatitis B, hepatitis C, and HIV that is spread by unsafe injection practices. So, what can be done? First of all, the hospital should adopt standard procedures that include safe injection practices as well as post-exposure prophylaxis guideline, which described what should occur after needle stick injury. For example, staff need to report the incident, they need to do the blood work, and to receive hepatitis B vaccine, immunoglobulin, or antiviral medication as required. In advance, healthcare workers should receive 3 doses of hepatitis B vaccine so that they are immune to the hepatitis B virus. Healthcare workers should receive continuous training and education on the danger of reusing and recapping needles and the blood-borne infection associated with them. Hospital need to eliminate the possibility of reuse of needle by discarding used needle in a puncture-proof sharp container at the point of care with an effective medical waste disposal mechanism which stops biohazardous waste from mixing with non-biohazardous waste, which will work to prevent disposal problems. However, one of the most important change is the auto-disable syringe. The auto-disable syringe will be the most effective mechanism to prevent the reuse of syringes. AD syringes are engineered with a safety mechanism to prevent reuse. Finally, the public should be empowered and educated so that they can ask questions to their healthcare workers regarding needle safety. It will also help to prevent them from asking for injectable medication when oral medication are available.